Today we've been helping you with stubborn problems that just won't go away. And our next issue comes from Janet in Colorado, who had this question about her mother.
Hi, doctors. My mom has a phantom itch on her back. For years, she's had us kids scratch that spot till it's nearly bleeding. We'd like to know what it is.
Well, Janet, there are dozens of things that can cause itching, some of which we can rule out if she's seen a doctor, about this condition. Number one, just aging. Your skin dries out a little bit as part of the aging process. That's why I tell everybody to moisturize. Mm-hmm. The other obvious thing is irritants, soaps, perfumes, certain clothing, certain people.
Especially new clothes that haven't been washed already are often full of detergents, irritants, things like that.
Exactly. Mm-hmm. Other systemic causes, you can be reacting to certain medications that may make you itch also. So there's a lot of different
systemic illnesses on rare occasions. If you have systemic itching all over. Now this is different. If you have itching in one spot all the time, but unexpected or unexplained itching can be a sign of a systemic
a drug
illness.
reaction. Let's say somebody's allergic to penicillin, they get the hype. That's probably going to itch.
Certain dyes too.
So that's an example of that. So treatments, what you should do, the obvious number one, don't scratch, don't rub. It's only going to make it worse. What may help, take a lukewarm bath using a little bit of soap and rinsing well, but don't wash too often because that's just going to dry out your skin even more. Try a skin-soothing oatmeal or cornstarch bath. I'm sure you recommend that for your kiddies, right?
Oh, for sure, yeah, especially chickenpox itching.
Yep, and especially in the winter, you want to apply a soothing lotion during the dry winter months. That's another cause
in terms of the moisturizing lotions like that, if you're, I tell my patients, if you're using it once or twice a day and that's not enough, just keep using it more and more. Even if you got to use it 10, 15 times a day, just to get your skin moisturized, then the itching will often go away.
But you're also talking about itching here without an obvious source. We talked with Dr. Ablon earlier, if you're seeing a rash or something associated with it, obviously you want to get the diagnosis because it could be an infection, it could be bug bites, it could be whatever. Like literally, if you have a constant itch in an area of your back where you have irritation, you could have bed bugs that, you never know. So look for those things, but you have something cool here for the average itch.
If it's really just dry skin that we talked about, whether it be from age or you're not moisturizing enough, you might have, in this case, Janet, have her mom use products put out by Sebamed. Dermatologists recommend these products, good for moisturizing. They last for different parts of the body.
Point is, try to avoid that temptation to scratch that itch because it just makes it worse. So try some of these moisturizing treatments. If you're not sure what's going on, as always, you can go see your dermatologist to try to get a diagnosis.